Eastern Cape Health Department will be receiving a consignment of personal protective equipment from China. The province has seen a number of protests at different health facilities due to the lack of PPE for frontline workers. The province has also seen an increase in infections among healthcare workers in private and public sectors, with over 250 cases and 14 COVID-19 related deaths. Health Minister Dr Zweli Mkhize also noted the alarming rate of infection and mortality in the province. Let's get more on the story. We crossed our reporter Yanga Funani at the COVID-19 call centre in East London. A very good afternoon to you, Yanga. It seems that it's not just about personal protective equipment, but also the manner in which people's cases are being handled in the Eastern Cape. Tell us more.
Very good morning to you, Nzinga, and to the scores of our audiences. Indeed, you are coming to us live from East London, where the provincial provincial Department of Health has just received PPEs. One will remember that this has been a thorny issue across the province, and to that extent, we have seen a spread of protests, particularly in rural hospitals. As we speak, there is an ongoing picketing which is happening at Glen Hospital in Ladyfrey. This is meant to address such needs as well. But now, to tell us more about this, we're joined by the MEC for Health, Sindiswa. MEC, thank you very much for joining us. Tell us about this, the current, what we've received, the PPEs we've just received.
Well, thank you. We have received some amount, very tangible, and pinafores, thermometers, facial visors, goggles, the rest from the Department of National Health, Dr. Mkhize. And these numbers, some of them are ranging beyond 1 million, some are close to 1 million, some are close to 500,000, and they will go a long way in actually supplementing what you are providing to some of our facilities, exactly in the manner that the strain of COVID on the ordinary work of facilities is also causing an issue, though the issue of PPEs for the Eastern Cape is no more the biggest challenge that it was.
Okay, we continue. The province continues to receive PPEs. On the other side, there are protests continuing in hospitals. For instance, just now, we just got information that at Glen Grey there is some picketing which is happening there. What seems to be the problem?
I don't think it's an issue of PPEs now. It was then, but the more we deal with issues of PPE, in terms of our staff and our healthcare workers, the more they will come out with something else. For instance, if you go to Glen Grey now, you will see that as they are doing, they are wearing PPEs. But again, what they are saying now is not about PPEs. They are saying they're not willing to nurse COVID positive people. So you start to wonder, how is it so? Secondly, that there's been a positive worker and maybe another one. Now they are wanting to believe that the hospitals should be closed and decontaminated in full. What we believe is that if there is an issue in a particular area in a hospital, that's the area that needs decontamination, not the rest of the hospital, and closure of a hospital, and that they are demanding to be tested, all of them. It is not a matter of those that actually are close workers who are in that area, but they're just demanding. So you never know whether it is really the issue or that really they're afraid to deal with COVID, or maybe it could be that they've got other issues that we don't know.
We continue seeing the number of infections, especially among health workers, growing uncontrollably. Part of the problem they cite is that they are not well equipped, they are not well trained. What does the department have to say about that?
Training as we speak, if you check inside, you'll find that it's still continuing on a daily basis. But what I want to believe is not necessarily that it is about training. Remember, all healthcare workers in their first year are trained as they get through Lilita training colleges as nurses. both in infection control and disease management. So for me, it is not just that, but I think COVID itself is an issue. Secondly, I do want to believe that we have now up and running OHS committees in most facilities. And those committees, one of their responsibilities is training. One of their responsibilities is risk management and assessment of hospitals. So to a certain degree, one might actually want to talk about something else that we don't know, as I say. But again, we're noticing that some healthcare workers become positive at the workplace, but some are also importing it from outside. Remember, they are equally members of the community. And when they do that, they sit in tea rooms together, they sit, and sometimes they draw the guard in terms of their own masks.
Okay. MEC, thanks a lot for your time, ma'am.
Thank you very much.
That's, of course, the MEC for Health in the province, Mamusindi Sokomba, telling us about the current receipt of PPEs in the province. She tells us that they'll be distributed as per need. One will remember that there has been a problem of PPEs in the province, and to a great extent, it has seen an insurgence of protests among health workers. Over 250 from public and the private health sector have contracted the virus. As from us here in the Eastern Cape, in East London, it's back to you in studio.
Yanga, I wonder if you could ask the MEC, if she's still there, about the fact that it's not just PPEs that have been attributed to the spread of COVID-19 in the province, but also the lack of contact tracing anecdotally, as well as the lack of proper steps in hospitals that lead to higher infections, that lead to people being infected or treated badly and not contained once they are infected.
Well, Nzinga, the MEC has left, but we do know that the Provincial Health Department has beefed up its tracking units. One will remember that over 2 weeks ago, the Health Minister Dr Zweli Mkhize was here in the province, and 2 weeks before that, he was here in the province to introduce tracking units as well. So what has since happened is that it has been they have been spread as per district, as per need, the priority being the two metros, the Buffalo City Metro and the Nelson Mandela Bay. But however, there are still challenges on that score. But as far as we know, some of these things are really challenges of lack of accountability from those who are on the field, and lack of, in fact, poor communication from them. So it would paint that picture. But however, the department in its own submission, it says that they continue tracking and tracing those who have contracted the virus.
All right, Yanga Funani, coming to us from East London in the Eastern Cape, that we have reporters across the country monitoring not only the reopening of schools, but the response of different sectors to COVID-19 in South Africa.